Now it's time for Real Talk.
Real talk.
Are you ready?
Okay, Deacon. Are we continuing this talk?
Part 2.
All right. What is it?
The poor state of America's population health. The relationship between class advantages in health signify class-based health inequalities are also documented within racial groups.
For example, the longevity prospects for white women and men without high school degrees are, respectively, some 10 and 12 years less than those for their college-educated white counterparts.
While the longevity prospect for black women and men without high school degrees are 5 and 9 years less than those of black college-educated counterparts.
Educational attainment surpasses race and gender as the most robust predictor of lifespan in the United States, as illustrated by two distinct but related white mortality trends.
Researchers have documented a rise in midlife mortality in white people with a high school degree or less, and an absolute decline in life expectancy in white people who lack high school diplomas.
Some evidence suggests that unmet material expectations and status loss take a heavier psychological toll on white people than people of color, whose communities have long endured and coped with socioeconomic deprivation and market volatility.
Racism has long impeded African Americans' access to pain management. Some researchers argue that economic anxiety and status anxiety interact to generate psychological stressors that explains white mortality trends.
Beliefs in this meritocracy integral to America's pull yourself up by the bootstraps class ideology may also be at work. White people who rely on this explanation to justify their flourishing and floundering may be more inclined to do so than people of color, who are more aware of the structural nature of inequality.
Black and brown people and others may be blamed for interfering with their explanation, or they may internalize their frustration as self-blame. Both reactions appear to harm health.
And experts point to a broad range of contributors, including high rates of adult and child poverty, limited access to quality child care, inadequate employment and labor protections, low levels of social mobility, and threadbare social safety nets.
Fragmented healthcare systems have left millions uninsured, underfunded public health systems, historic levels of income inequality.
Reforms will need to respond just as broadly with policy measures that cut across American lives, from child welfare to education, labor and employment, healthcare and public health, housing and taxation, a whole of society strategy advocated by the population health approach that works. Culture of health and health in all policies.
Health studies can instead show that we all have skin in the game. Take death of despairs. This story was told as a problem that affected white people because up until 2013 it was. But black and brown people are affected too. And young high-income black women are at the exceptionally high risk of opioid misuse.
Moreover, what is happening to poor and working class white communities happened first to the poor and black and brown communities, who were devastated decades ago by a crack cocaine epidemic with roots in many of the same economic and social forces now undoing poor white communities.
In the United States, white and black women with less than a high school education experience far too many infant deaths. 8.8 deaths per thousand, 11.6 deaths per thousand, which translate into over 1,337 white infant deaths, over 1,013 black infant deaths. These data should be called a national action of improved outcome for pregnant women, all races and classes.
And finally, recall the U.S. health disadvantage. Health outcomes at the lower ends of the socioeconomic distribution, populated by people of all races, including some 18 million officially poor white people.
But white supremacist effort to fill the void created by Americans collectively reluctant to acknowledge and talk critical about white privileges and poverty. Now, that's real talk.
Be sure to listen to us on the KWAY Digital Broadcast app, KWAY-DB, and guess what?
It is free.
Yes, it is. And online at www.kwaygospel.com. And we're also on Spotify, Apple Podcasts, and Podbean Podcasts.
So please don't miss your blessings.
We'll look forward to you listening to Real Talk.